Hi, my name is Alejandra,
My name is Katrin.
and we are doing our presentation on lupus. What is lupus? Lupus is an autoimmune disease that attacks the body's tissues and organs by causing inflammation and pain throughout the body, varying from mild to severe cases. So there are different types of lupus. The first one is SLE. It stands for systemic lupus erythematosus. This one is the most severe and is seen on 70% of the cases. It affects multiple organs or systems at once. Inflammation in the lungs, kidneys, skin, heart, joints, and blood are all some of the inflammation types that it causes. And then there's also DLE, which stands for discoid lupus erythematosus. This one appears in the surfaces of the skin, the scalp as lesions, most common on the face, but it can also appear in other parts of the body. Then there is neonatal lupus. This one occurs at birth if the antibodies are passed through the placenta from either mom or dad while the pregnancy is in progress. And then there is DIL, which stands for drug-induced lupus, which is caused by long-term use of medications, such as isoniazid, which is used for tuberculosis treatment, hydralazine, which is a vasodilator, then also sulfasalazine, which is used to treat ulcerative colitis and rheumatoid arthritis. And then also anti-seizure medications can cause this, amongst many more. When was lupus discovered? So in the 13th century, Rogerius Frugert, an Italian physician, used the term lupus, which in Latin means wolf, to describe the skin lesions which seemed like wolf bites. These bites were seen in the face and other parts of the bodies also, but he called them like this because that's what it resembled to him. At this time, there was no treatment for none of this. It wasn't until 1851 when French physician Pierre Cazenave was the first to document extensive information, which led to the diagnosis of DLE and the facial rash as the most common symptom. He also noted this affected adolescents to adults in their early 30s. And in 1872, lupus was termed as chronic by Ferdinand von Hebra and his son-in-law, Moritz Kaposi, who also suspected lupus caused internal damage, not only topical, which would be the SLE. And von Hebra was also the one who noted the butterfly rash in 1846. Though the causes of lupus are unknown by doctors, researchers believe certain factors can increase the risk of developing lupus. A gene that is obtained at birth can be altered by an environmental factor and lead to lupus. There has been more than 50 genes that have been associated with lupus, though they do not directly cause it. These genes have been found on people who have lupus more than those who don't. Medications, if taken as long-term treatments like the ones I mentioned previously, and then also sunlight exposure can trigger skin lesions on susceptible people. Symptoms vary from person to person. They can be very mild to very severe, but not everyone has the same symptoms. Some of these symptoms are fatigue, fever, joint pain, swelling, the butterfly rash, headaches, chest pain, anemia, and hair loss. The butterfly rash is one of the most common ones. And you can see a picture right here on the bottom corner on the right. And there's some other pictures right here. And we're going to the next slide. These symptoms are most common in females. So lupus is seen more in females than in males. And the onset of symptoms start from 15 years of age to 45 years of age. Symptoms appear as temporary or remain forever. In SLE, which is the most severe one, symptoms may attack multiple areas or organs at once. Flare-ups do occur, but remission is also possible and it can last up to many years.
So next up, we're going to be talking about the physiology of how lupus affects the body. And I'm going to specifically be talking about SLE, which is systemic lupus erythematosus, which makes up about 70% of the cases, as mentioned earlier. And the symptom that I'm going to be focusing on is inflammation. Just a little background, the immune system is supposed to protect the body's tissues, but since this is an autoimmune disease, the immune cells attack the tissues instead of protecting it. And this can happen in different tissues and organs in the body. Lupus can be caused by several factors, as mentioned earlier, but I'm going to give an example of lupus caused by genetic and environmental factors. So say that a person has faulty genes that makes them prone to getting lupus, and that person is always exposed to sunlight. If there's too much exposure of sunlight, the UV rays can actually cause the cell's DNA to be damaged, and it can go through apoptosis, which is seen in the picture here, where you see that the cell breaks apart and dies. So when the cell dies, it breaks into apoptic bodies, and then the inside of the cell is exposed. And you can see the little fragments here that represents the parts of the nucleus, such as DNA, proteins, and histones. Those are actually called nuclear antigens. So when the already faulty genetics of the immune cells detect the nuclear antigens, they mark it as foreign and they mark it for destruction. So those cells attack it. And since they have faulty genes, the immune system doesn't really do a good job at cleaning up the apoptic bodies and the nuclear antigens. So a lot of the parts of the nucleus are just circulating and just building up in the body. So the immune's response to that is that B cells create antibodies against parts of the nucleus, and these antibodies will bind to the nuclear antigens and form antigen-antibody complex. And the antigen-antibody complex will enter the bloodstream, and it can stick to tissues like the kidney, the skin, the joints, and this will cause inflammation, and it just damages the complement system and causes healthy cells to have little holes in them, which allow fluid and particles to enter, causing it to burst and die. So that is why that causes inflammation in the different parts of the tissues and organs. For treatment, currently there is no cure for lupus. There are only ways to alleviate and reduce the symptoms, but the three main goals of treatment is to reduce inflammation, to prevent flares, and minimize damage to the organs. So I'm just going to be talking about the different types of treatment and types of medication. First up, we have the non-steroidal anti-inflammatory drugs. For example, there's Motrin, ibuprofen, Advil. It treats swelling, pain, and fever. And as mentioned earlier, some of the symptoms of lupus were inflammation of the joints and fever. So this would definitely be the medicine that they would take. Some cons, though, with this medication is that it can cause bleeding, stomach bleeding. It could cause kidney problems and could even increase the risk of heart problems. Next, we have hydroxychloroquine, which is an anti-malarial drug, and it helps flares up to 50%, helps reduce flares up to 50%. It prevents blood clots. Some cons about this medication is that you can get an upset stomach, and in some rare cases, it can actually damage the retina in your eye. So it's important to have regular eye checkups with your eye doctor. Um, Next up, we have immunosuppressants, which is beneficial in serious cases of lupus, especially when people have kidney transplants. This helps the body not reject it. And it does have its downsides, though. It does put the patient at an increased risk for infection because it does put down the immune system. And it can also cause liver damage and decrease fertility. Um, Another method would be biologics, which is belimumab, which is administered through an IV. The medication slowly drips through the tube and releases it into the bloodstream. And this method is usually used if other medications have been failing or not relieving any of the symptoms. And biologics are mainly used to treat inflammation. Um, but it does have its side effects. It can cause nausea, diarrhea, infection, and fever. Another way you can reduce your symptoms without medicine is by making lifestyle changes. So, definitely no smoking. It's important to reduce your exposure to sunlight. Um, you should have a heart healthy diet and exercise regularly to maintain a healthy weight. Um, Go have regular checkups at the doctor. And it's also helpful to have support groups within your family, your friends, and even other people with lupus, not only to deal with the physical effects, but even the mental effects of lupus. So for the lifespan, about 80 to 90% of people with lupus can expect to live a normal lifespan as long as it is diagnosed and you are getting it properly treated. Some research that has been done on treatments. There's voclosporin that was FDA approved in January of 2021, and it helps with lupus nephritis, which is the inflammation of the kidneys. This medicine is usually taken alongside other medications, and there's also mesenchymal stem cell research, which started in 2008. It's especially being studied for those who have refractory lupus, and that's when lupus doesn't respond to any other treatment. And there are currently 11 studies going on, and the studies have been done on mice with mesenchymal stem cells. There has been reported improvement in kidney disease and life expectancy. And it also has shown success in those who have refractory lupus. The whole goal of these stem cells are to reset what is wrong in the immune system and just to reduce the use of medication like steroids that have long-term harmful side effects on the body. So now we'll move on to the interview portion.
So for our interview, we interview a close friend of mine. She was diagnosed in 2015. She was 20 years of age at the time that she was diagnosed. So for the first question, which is, how long have you had this condition? She answered, I have had lupus SLE for 7 years. SLE is the one that's the most severe one. For the second question, we asked, what experiences have you had with lupus? To this, she answered, in my specific case, it attacked the tissue in my heart. I almost had a heart attack due to the pericardium being swollen. During my flares, I experienced all symptoms: muscle pain, chest pain, anemia, fatigue, hair loss, face rash, which is the butterfly rash, joint stiffness, and swelling. She also did mention that her iron level was already at 4, so that's why she had the anemia. She also said she couldn't move and she needed help when getting up. I felt miserable, she said. The third question we asked, what treatments have you had? She answered hydroxychloroquine, prednisone, Sofran, dicyclomine, cyclobenzaprine, vitamin D3, and ranitidine. I've been on remission for about 4 years. And then for the last question, the question was, how has your family supported you throughout this condition? To this, she answered, I'm so thankful for my mom. Sleepless nights at the hospital, making sure I never missed my meds. She was always there. My dad and brother as well. They were always ready to take me to the hospital when needed. My now husband has always been there for me as well. When I got diagnosed, we were only dating. I tried ending the relationship with him because I didn't want him to marry a sick person. He decided to not leave my side and help as much as he could. Sometimes he would take days off when I was at the hospital to go and be with me. Then, shortly after we got married, he took me out of work. I am grateful for the family I have. So, this would conclude our presentation. If you would like to learn a bit more about this condition, we did put the sources we used in this slide right here. You will find basically all the information that we put together. So yeah, that's it. Thank you.